pond5.com.
One of the reasons this virus spread was related to the poor health infrastructures and training of the people. Answering to Ebola is not strictly medical. It's mostly about social mobilization, and that can concern vast group of people. At the peak of the epidemic, we were having about as much as 25 to 26,000 people involved.
When the Ebola outbreak came, the health infrastructure of Sierra Leone was either virtually non-existent or extremely weak. As long as you were working in healthcare, you were also at risk because they were the first points of contact. And because of that, it was not just meant for healthcare workers. We decided to make sure that the whole process became Ebola response workers.
So one of the areas which was very challenging and very complex is the Ebola response workers' payments. And the government really needed help in order to systematically improve that area and the Ebola response worker be paid so that they can work.
The real issue was about how do you go into the remote area where the closest bank is a 2 hour to 3 hours drive from the CTU. So since those people couldn't reach the money, we had to make sure the money reached them.
Hazard pay had the most impact on getting the people in this country to come in and join the fight, regardless of how many medical doctors we would have had coming in. If the hazard pay was not around to get the staff to go out in the field, get the sick, get the ambulance drivers, to get the nurses to go in and get these people, it would have been a very difficult situation.
De pouvoir d'abord accompagner le gouvernement à travers la cellule nationale de coordination de la réponse à l'épidémie, de pouvoir leur permettre de mettre en place la base de données qui était en ce moment-là encore non disponible. Il était aussi question de pouvoir mettre en place un mécanisme clair et cohérent, de faire parvenir les paiements au personnel sur terrain.
We focused on a specific groups of Ebola workers, and what we managed to secure is to make sure that we could deliver via local branches of banks, and actually we could cover as much as 60% of that population via the banks. So since those people couldn't reach the money, we had to make sure the money reached them. So what we did, we called it the mobile over banking system. We brought and opened temporary branches of the bank closely to the concerned treatment centers. So it was all about making sure we paid who deserved to be paid, and we paid him on time.
This is one of the fastest rolling out of mobile money. The biggest advantage is that you directly know where your money is and how much you received. We established a help desk in each district. When we get any feedback, then we immediately communicate with the mobile company.
We wanted to have a clean list of payees. So once we got a clean list of payees, at that time, we decided that we should employ the services of the mobile network operators, the MNOs. The teams did it directly on the table, face to face, where they captured photographs of people, their names, and some form of identification. This was one exercise that was going to be human resource intensive.
A lot of people now volunteer to come and help. Even though we have enough people, you have a lot of people who say, no, I can go in a treatment center and work. And I want to be recognized as someone who is working in a treatment center.
I appreciated the training because I'm able to cross through this darkness with my family of 18. Up to date, I've lost none of them. We are all well and good if you follow the rules and the regulations of the health workers, the experts. You won't get Ebola.
When the incentive started coming in, to give more courage to people, at least when you are exposed and you have something to take home and take care of your family. I had 2 kids, so I used my money to take care of them. Before this time, I was not having a structure where I live now.
We appreciate really for this hazard payments because some of us, as for me, I'm a widow. I lost my husband 5 years now. But this hazard payments helped me greatly. My elder son is in the university. The hazard payments helped me greatly. I did what I'm supposed to do for him. But some of us who have interest in our job, who love our job, we decided to come. And thank God when we came, they are giving us this hazard payment just for they are motivating us. Thank God for that. We didn't work for nothing.
Without the incentive pay, it would have been extremely difficult to get enough people to work in all of these places. This is 2 million leones a month in addition to that 800,000 that they were getting. This made the biggest incentive. It was indeed a great, great help to them, to their families, and of course to the country for the work they've done.
Nous devons maintenir le cap pour renforcer même cette situation, pour éviter encore des maladies épidémiques.